Hello, this is mental health consultant Jason. Today we will be learning about the H&P Mental Health Status and Substance Abuse Exam. The purpose of this training is to educate H&P RN staff about best practices to utilize when giving the mental health status and substance abuse exam to clients. Prior to beginning the mental health status exam, you will have already gone through the health history portion of the comprehensive health assessment form. When that portion of the exam is complete, it would be helpful to prime your client for the next series of questions regarding their mental health. You can do this by a segue such as, now that we've talked about some of your physical health history, I'm now going to ask you some questions about your mental health history. Is that okay? Asking for permission from a client before beginning the mental health questions will increase buy-in from them, as well as the likelihood that they will be open and honest during the assessment. It will also likely help to make clients feel more comfortable if you inform them that they don't have to answer any questions, but that the questions that they do answer will help you to understand them better, and in turn give them better care. It is important to remember that whenever conducting confidential health-related activities with clients, to attempt to do so in the best setting possible. Always try to interview clients in the most confidential settings available. The H&P Mental Health Status Exam is comprised of a series of yes or no questions that you are required to ask clients. If a client answers yes to any question, you must provide an explanation below it to expand on the information. The first question on the mental health status examination is if the client has a history of any previous hospitalizations or treatments for mental illness. It may help to clarify the question to clients by letting them know what past treatments may include, such as going to see a counselor, therapist, psychiatrist, or psychologist in the past. If a client answers yes to any of these questions, ask them what time frame their hospitalization or treatment occurred, what institution or provider they saw, and what prompted those services. The next questions are about a client's history of suicidal ideation, attempts, and self-harm. It is very important to understand that most clients fear being placed on suicide watch, and as a result, will often be highly resistant to answering questions about it. It may be beneficial to tell clients before beginning to ask questions about suicide and self-harm history that they will only be put on suicide watch if they are actively suicidal currently, and not if they report a history of suicidal ideation or attempts or a self-harm history. Suicidal ideation is when people think of committing suicide. You can inquire about suicidal ideation by asking a client something like, have you ever had periods of time where you thought about killing yourself, even without following through? Suicide attempts are actual times where someone takes action with the intent to kill themselves. You can inquire about suicide attempts by asking a client something like, have you ever actually tried to kill yourself other than just thinking about it? Please remember that people can have suicidal ideation, sometimes for years, without a history of attempts. If a client has a history of attempts, it may help to ask about the means they use to try and kill themselves. You can inquire about this by asking simple questions such as, how did you try and do it? Pay special attention to attempts that involved hanging, cutting, and medication overdoses, all of which have some of the highest likelihoods of succeeding in custody. It can also help to inquire as to the motivation of the client to die. You can do this by asking questions such as, why did you want to kill yourself? It is also often helpful to ask clients how they survived the attempt. You can do this by asking questions like, how did you survive it? Finally, you should ask clients if they have suicidal ideation currently. Please do not say things like, you're not thinking of doing anything stupid, are you? Because statements like this are judgmental and reduce the likelihood that clients will talk to staff about suicidal ideation or attempts in the future. Instead, you can ask questions like, are you feeling that way now at all? Self-harm can occur without the intent to die. Typically, self-harm takes the form of cutting or burning oneself. Physiological cues can give you insight as to whether a client has a history of self-harm, such as visible scarring on the forearms, typically the left forearm. Other common places that people self-harm are on the thighs and stomach. You can inquire about self-harm history by asking questions like, do you have a history of self-harm by doing things like cutting or burning yourself? If a client affirms that they have, ask them when the last time they engaged in that behavior was. If they have untreated wounds, treat them like you would any other injury. Also, let them know that such behavior is not acceptable in custody, and that if they feel like they might act out in that way, that they should let someone know so that they can talk to RN or mental health staff who can help them cope more effectively with their problems. If you have any significant questions or concerns about suicide or self-harm following an interaction with a client, please refer to the RN suicide prevention training or collaborate with a coworker, supervisor, or mental health consultant. A link to the RN suicide prevention training will be provided in this video description, as well as on this training's quiz page. If a client ever reports that they are actively suicidal when you are talking to them, immediately place them on suicide watch and inform a unit deputy to ensure the client's safety. The next question inquires about a client's possible history of exposure to violence or abuse. Before asking this question, it may be helpful to inform clients of your status as a mandated reporter, which means that if a client indicates that they have been sexually assaulted, or if you are made aware of a child or elderly or a mentally incapable person being abused, that you must report it immediately to your supervisor. When asking trauma-based questions, it is best to inform clients of the different types of violence or abuse they may have been exposed to, such as physical, sexual, or emotional. If a client states that they have been exposed to violence or abuse, ask them if they would like a referral to mental health staff to help with their issues. Expressing empathy towards clients by stating something as simple as, "I'm so sorry that happened to you. Please let us know if there's anything that we can do to help," may go a long way towards establishing a trusted relationship with a client and helping them to cope. The next question is about a client's history of acting out in anger or violently, which has resulted in them getting into trouble. Explain that trouble does not necessarily have to mean legal trouble and could include interpersonal issues, like a history of fighting or arguing with loved ones. Again, we must ensure that we do not appear to pass judgment on clients if they express a history of violence and anger. If a client indicates that they do have a history of violence or anger, ask open-ended questions to elicit more information about the circumstances, with questions like, "Tell me more about that," or "Explain that to me." Ask clients with a history of violence or anger if they want a mental health referral and anger management packet to help them to cope with these issues. You can also ask about how clients can cope with anger issues by asking questions such as, "How are you going to manage your anger issues in here?" The next question is if clients have ever been accused of sexual offenses. Keep in mind that sexual offenses are highly stigmatized in the community at large, and even more so in incarcerated environments. Clients with sexual offenses are often threatened, taken advantage of, and are socially alienated from peers. They also have a higher likelihood of attempting suicide. If a client states that they have a history of sexual offenses, ask them if they are safe in their current housing or if they are having issues with their peers. If they state that they are having issues, consult with your supervisor or security staff to ensure their safety. The next question is about a client's history of developmental and/or educational disabilities. Ask clients to be as specific as possible if they state that they have developmental or educational disabilities. You can get more information about possible disabilities by asking if they were part of an individualized education program, or IEP. You may also want to check if the client thinks that their developmental and/or educational disabilities will affect their incarceration, and if so, how. Be especially mindful of a client's level of health literacy when explaining medical procedures and concepts to clients with developmental and/or educational disabilities, and adjust your level of explanation as necessary. The final question in the mental health status exam is about how clients think they will adjust to incarceration. You can encourage clients to contemplate coping skills to manage their incarceration by asking questions such as, what kind of things are you going to do to take your mind off of things and help you manage and pass the time? Also, asking general questions such as, what can staff here do to help you adjust, can help clients to be more at ease and to request help if needed. As usual, if clients request help or resources, make referrals as necessary. When initiating the substance abuse history section of the H&P form, you will ask clients if they have taken a variety of drugs and explore their history of substance use. Begin by asking them if they have ever taken any of the following drugs: alcohol, methamphetamines, marijuana, cocaine, heroin, or other opiates, or any other drugs such as benzodiazepines and tobacco. If a client indicates that they have taken a drug, ask them when they began using the substance. Next, ask them how often and how much they used. There are street terms that indicate different amounts of drugs, such as a ball or 8-ball, which means 3 to 3.5 grams, and a tea or teener, which means approximately 1.75 grams. If a client makes a vague statement about alcohol use in particular, such as a couple of beers a day, please investigate what this means. Asking what type of beer and how big the containers are can mean a significant difference in the amount of alcohol consumption. Next, ask about the route of drug administration. The most common methods of administration include snorting, ingesting, smoking, and injecting. If a client indicates that they inject drugs, offer and encourage them to get HIV and hepatitis C testing while in custody. Also, ask them if they have ever shared needles, even once. Also, ask clients when their last use was. If they were recently taking substances that can lead to significant withdrawal, such as alcohol, benzodiazepines, and opioids, inquire about their withdrawal history and if they are withdrawing currently or are likely to withdraw. If they are, utilize withdrawal checks and protocols as necessary. That is the end of the training. Thank you.